a heart valve scientist. I've been doing heart valve research for 25 years. I spent most of that time at the Cleveland Clinic. And in those days, the idea was, can we make tissue valves last longer? Because nobody wants a reoperation. When a tissue valve wears out, you have to do open heart surgery to replace it. So for decades, all the scientists, all the heart valve companies were focused on making heart valves last longer. This is never going to happen. We're never going to have a 30-year valve. So if the purpose of making heart valves last longer is to avoid the redo surgery, how about we go around this problem in a different way? How about we make the redo surgery so benign that the patient would rather be in a tissue valve, rather have the redo surgery than the alternative, which is to have a mechanical valve and be on anticoagulation for the rest of your life. Nobody wants to be on anticoagulation. So that was the basis for ValveXchange, to obsolete all mechanical valves, to create a tissue valve that will last the life of the patient, not by being durable in some miraculous way, but by being exchangeable, to actually replace the worn out components, much like one replaces the tire of a wheel without replacing the entire wheel. It's a serviceable heart valve. It's really the only heart valve that is designed to be serviceable, like all mechanical devices around us.
And if you could lighten, so to speak, the weight of the redo procedure, in that the explant would be facilitated by some means or other, such as incorporated in the concept of the vitality valve, that would help physicians and surgeons, and of course benefit the patients in the end.
Now the vitality, if you only take out the leaflet part, leaves the annulus in place, so the potential damage of the annular part is much less. And if you just click on a new leaflet part, I think this will make a redo procedure much more easier with the vitality valve.
It became very clear to me what a good, timely technological innovation this was, and how it could disrupt the current tissue heart valve market. So along the line, I've made several investments in all.
Very easy and minimal invasive in, so that was what I'm impressed about this. And also the surgeon was very interested about this idea for the future, saying that is a very good opportunity, makes easier handling and more safety for the patient. When they have more and more experience about this technique, they will more and more implant this, and then it's sure.
We now know that we can't make a tissue valve that lasts 30 years. But what we can do now is replace the tissue valve with minimal trauma to the patient. That was the basis for ValveXchange, to obsolete mechanical valves and to free patients from cumulative therapy by having a heart valve that can be serviced, repaired when it wears out, like all mechanical things around us. It's a very simple concept, actually.